Hey everybody, it's Dr. Haugen here, and I want to take some time to talk about a case or some pain that some of you may be dealing with. I saw this man in my office here a couple weeks ago, and I want to talk about what he presented with as far as pain because this can kind of get misdiagnosed. And so when he came into my office, if you look at the screen here, he had pain down here in the bottom of his back, right here in the SI joint. So a lot of people think a pelvis pain or a pelvis issue right away, and that would normally be the first thing that I would think of too. But he also had, if we spin this guy around here, he also had pain that went down the side of his leg, and he had pain that wrapped around to kind of to his stomach, and he actually pointed to this area right here by his stomach where he had abdominal pain. He had actually been into the hospital and they couldn't figure out what was going on with him, and they couldn't find anything wrong with him. And so the next spot that he had pain is he had pain down here in his groin. And so he had these three spots really where he had pain, and they were all lower. So abdomen, side of the leg, and his SI joint is where he was feeling this pain. When something comes in like this, we need to think kind of deep about this because this is something that a lot of times gets missed. And this syndrome right here that you're seeing is actually called thoracolumbar junction syndrome. It can be called Maigne syndrome, lumbodorsal syndrome, posterior ramus. Doesn't matter. The point is if you have pain like this and you can't quite figure out what's going on, so some SI pain, pain in the front of the groin, maybe pain in the abdomen, most of the time if you look here, it actually comes from T12 and L1 in your mid-back. Now that seems really odd, doesn't it? And that's why this goes misdiagnosed so many times. The problem is actually here, and this is actually referring pain into these spots. And so what we had to do to help this guy out was start to get his thoracolumbar junction or his mid to low back start to work again. And so if you see something like this where you're having SI pain, you got pain down the side of your leg, maybe pain in the groin, and you can't seem to get rid of it, a lot of times it's not actually coming from those spots. So this is something to think about if you know someone who's struggling with something like this, or maybe you struggled in the past. A lot of times it's actually coming from that mid to lower back, and that pain is getting referred. So take the time, kind of, if you know anybody, share this video with them, and you can kind of see here. I did my best. This is in 3D paint. Drew this out so you guys can kind of understand what's going on here and how these pains can be referred and how this can be missed. Because if I would have just adjusted this SI joint, we probably wouldn't have resolved everything. And so by adjusting through here and really knowing where the source of his pain was coming from, we actually got rid of able to help with the abdominal pain, the leg pain, and the SI pain. So kind of a big deal. If this is going on with you, this is something that could definitely be the source of your problem. Maigne syndrome, it's called. So check this out. If you know anybody struggling with something like this, share it with them so that they can get the help they need. Thanks for watching, guys.